Good afternoon, everyone. My name is Jerome Bailey, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted to the NCC COVID webpage, usually within 3 business days. Many times we will have the recording up on the webpage well before 3 business days. Let's take a look at the agenda for today's call. Today we are happy to have Dr. Jonathan Segal. Dr. Segal is with the University of Michigan, and he serves as the chair of Midwest Kidney Network Medical Review Committee. The patient we had scheduled on the call, unfortunately, cannot be with us today. So what's this call about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And we want to let you know that this series of calls is available to you, offering a variety of topics. Before we get started with our presentation, we wanted to share with you a few online resources. The NCC website offers many COVID-19 patient resources, from where to find credible online information to ways to empower yourself to learning how to connect virtually with others. The COVID-19 Patient Resources webpage offers a variety of information. You can access handouts, webinars, videos, and links to trustworthy organizations. If you haven't visited already, check out www.Kidney COVID Info Center and click on For Patients. Check back often because new resources are added frequently. So the NCC website also offers a web page with information for patients or family members. The resources available on this page would be appropriate for someone new to kidney disease, someone who is thinking about changing their treatment option, or learning more about current treatments. The resources provide information about what to expect if you have recently been diagnosed with kidney disease and need to consider dialysis or transplantation. It discusses choosing transplant or home dialysis, infection prevention, emergency planning, and there is a section for caregiving. Because it's important to know about other organizations that provide trustworthy information, links to reliable sources are also provided. Please visit esrdncc.org/patients. Let's begin with our presentation. As our panelists go through his presentation and you have questions, please submit them using the chat feature through WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with our speaker. Our goal is to answer as many questions as time allows. Let's learn more about our speaker. It gives me great pleasure to introduce Dr. Jonathan Segal. Dr. Segal is a nephrologist who has been providing care for patients with kidney disease for 20 years. He graduated from the University of Chicago, Pritzker School of Medicine, and is currently the director of the Kidney Epidemiology Cost Center at the University of Michigan, where he helps develop quality measures for dialysis facilities. Dr. Segal is active in the kidney community, volunteering with the American Society of Nephrology, the National Kidney Foundation, and as I mentioned earlier, he is chair of the Midwest Kidney Network, ESRD Network 11 Medical Review Board. Dr. Segal, thank you for being with us.
Thanks so much for the opportunity to speak today about telemedicine. It's an area that I've really become excited in over the past several months as we start to realize a lot of the possibilities that it brings. I want to encourage you all to ask as many questions as you can possibly think of during the talk today, because we are going to have a bit of extra time since we don't have a patient with us to share their perspective. So I'll have to fill in a little bit for the gaps. But like many providers, as well as patients, I was thrust into telemedicine this spring when the COVID pandemic first struck. And over the past 6 months, we've learned a lot about how to provide care remotely. And so today I'm going to discuss a little bit about how telemedicine has evolved. We'll talk about a few tips and observations about how to get the most out of a telemedicine visit. And we'll talk a little bit about what the telemedicine landscape may look like in the months and years ahead. Just to kind of back up and start at the beginning, and if we can go to the next slide. With the rapid growth of electronic medical records over the last several years, there's been a lot of electronic health jargon, and I find many of these terms to be particularly confusing. So to start out with some definitions, when we talk about telehealth, we're talking about the practice of caring for patients remotely. So both the patient and the provider are not physically together in the same room, which is what has traditionally happened with medicine over the years. In addition, the use of telemedicine implies that there's both an audio and a visual connection between the two people. If it's just an audio connection, I think we typically call that just a phone call. And so that's where telemedicine is different because of the video part of things. And telemedicine is different than other types of healthcare services that can be provided through what's called asynchronous communication. So asynchronous means that communication is not happening in real time. Some examples of asynchronous communication would be a portal message that you might have between a patient and their provider, where a conversation may go back and forth over, if not hours, days, sometimes even weeks. There are also e-visits for common problems like a urinary tract infection or upper respiratory infection, where you can fill out a bunch of questions about symptoms that get submitted to a provider and they get back with you relatively quickly, but it's not there's no actual conversation that's happening, there's no images that are happening, and there's no information going back and forth in real time. So those are what we call asynchronous communication. That's not what we're talking about today. So that's at least just a little bit in terms of the definitions. Now, prior to 2019, telehealth existed in dialysis, but it was really quite limited as patients had to be at an approved site. And so typically this meant that it was being done in rural areas where patients would often live, really far away from a dialysis clinic. The VA health system for veterans has been involved in telehealth in the past and continues to do so. And in 2018, you may be familiar with the ESRD Seamless Care Organizations, or ESCOs. This is an alternative model for trying to provide better quality care at a lower cost. These ESCOs that were in existence were given a telehealth waiver. But aside from those couple examples, telehealth was not at all in the mainstream, even just as few as a couple of years ago. So what changed in 2018, what's called the Bipartisan Budget Act included a clause for telehealth specifically for dialysis, and it expanded access to telehealth because it included the patient's home as a, quote, approved site to do telehealth visits for home dialysis patients. So this change in legislation went into effect on January 1st, 2019. And at that point, some dialysis facilities and nephrologists were just starting to offer telemedicine under this new legislation for patients, but uptake was relatively low. For starters, it meant investing in a technology platform to offer it. It meant, changing the way we do care, right? Retooling clinic visits and training. And it takes a lot of it takes a lot to break free from the inertia of the routine clinic visits that we've come to know over the years for dialysis. Once the COVID pandemic began, telemedicine took off literally overnight. Now, this was in part due to the need to limit exposure in the clinic to patients, but also because some of the requirements for face-to-face visits were temporarily suspended by CMS. So to review, because these things are going to be important as we move forward, the legislation for telemedicine stipulates that a face-to-face visit is needed for new patients on dialysis in the first 3 months. So those first 3 monthly visits, patients need to be seen in the clinic. And that kind of makes sense. There's a lot of changes that are going on in the first few months of starting dialysis. There's a lot of adjustment that needs to happen, both from the dialysis prescription, medications, fluid balance. There's obviously a lot of emotional and mental health adjustment that needs to happen in terms of coping with kidney disease and dialysis. And so I think those face-to-face visits in the first few months make a lot of sense for patients to have the interaction with the dialysis care team. The other kind of part of the legislation mandates that a face-to-face visit is needed once every 3 months for a patient that's doing telehealth. So 2 of the 3 visits can be through telemedicine. 1 of them every 3 months has to be in person. So that's kind of the way the legislation was structured. Once the COVID pandemic hit, CMS relaxed those 2 requirements for face-to-face visits. They basically said all patients can get seen through telemedicine. Doesn't matter what month it is. They were going to temporarily suspend all that. And telemedicine was expanded to cover in-center hemodialysis patients, which weren't typically covered under this legislation. And transplant centers started doing evaluations through telemedicine. The other thing that helped kind of jumpstart this movement is that CMS relaxed the technology requirements that were required for telemedicine. So although we obviously want to use secure communication to protect privacy, in the short term, basically they said any way you want to communicate is fine. So that means using FaceTime if you're on Apple, or Skype, or basically any way that you could do a reasonably secure connection that had video and audio was fair game. And so that really, those relaxing of some of the rules really helped get telemedicine off the ground earlier this year. So if you go to the next slide. So with telemedicine, patients can seamlessly engage with their healthcare team. And this can be as simple as we discussed as using real-time video to allow communication back and forth. But it can also allow more sophisticated transmission of clinical data, such as blood pressure or heart rate. It can include treatment parameters, such as machine alarms, missed or shortened dialysis treatments. In even more sophisticated setups, physical exam findings can be transmitted to the healthcare team. And we're going to talk a little bit more about that in just a minute. So using all of these inputs, just like in a face-to-face encounter, providers can change the dialysis prescription, adjust medications, or counsel patients on how to improve outcomes, how to avoid hospitalization, how to minimize the disruption that dialysis has on day-to-day life. Much of today's discussion is going to focus on the use of telemedicine for home dialysis patients, but in the midst of the COVID pandemic, there are clearly applications for in-center dialysis. And beyond that, there are enormous implications for telemedicine in terms of caring for patients who have chronic kidney disease who are not on dialysis, or for kidney transplant evaluation and management. So lots of potential uses, and we'll touch on some of those a bit later in the call. So if we go to the next slide, I want to take a few minutes and run through both some of the advantages and disadvantages of telemedicine. I think one of the biggest benefits that we think about with telemedicine is probably related to decreasing the need for travel back and forth to the clinic for routine care. Now, typically, we think of this in more rural settings where patients may live quite a distance from the dialysis unit. But the truth is, you can make a compelling argument for telemedicine even in urban settings where patients may have to deal with traffic jams and awful parking and commuting with public transportation. So I think that the distance argument doesn't really necessarily hold up. I think there's absolutely applications in more urban settings as well for patients. The key advantage is really the flexibility in scheduling as one of the big benefits, particularly for patients who are trying to juggle dialysis in the midst of working or going to school or simply trying to care for their family. Living in Michigan, where I'm at, in the wintertime, a snowstorm can clearly be the difference between being able to come in for a monthly clinic visit or not being able to. But with telemedicine, we can quickly convert an in-person visit to a telemedicine visit so that we're not deferring care. Whereas in the past, if there was a snowstorm, I would tell patients, look, don't get on the road. It's not worth your safety or risking your safety. We'll reschedule, and it may not be until next month, but it's not worth getting in a car accident. Now, we don't have to do that. Now, clearly, with telemedicine, patients still need to have labs done. They still need to see the nursing staff, the dietitian, the social worker, but there's a lot more flexibility so as not to be limited by a weather event or, worse yet, a doctor's in-person clinic schedule. And last, and what I was really struck with over the past several months is that being at home for many people is clearly more comfortable than sitting in a clinic exam room. But I don't think I really appreciated what kind of difference that is for a lot of people until I saw this firsthand. I have a clinic patient who I see regularly, and when he comes in for a clinic visit, he's generally a pretty reserved guy who doesn't always engage really well with the whole healthcare team. But when we started doing telehealth visits and he was at home and clearly much more comfortable, he became incredibly chatty and really opened up and communicated quite well. So it was a noticeable difference between the interactions that we had in clinic in person and through telehealth. And frankly, I think the telehealth visits were working out a whole lot better for this individual relative to coming into clinic. Let's talk a little bit about disadvantages of telemedicine. The single biggest disadvantage, at least from the provider's perspective, is the limited ability to do a physical exam. And this is particularly true when acute symptoms or problems come up where the physical exam can often be most revealing. Now, there are some technologies that can help with this, but they're not in the widespread use right now, in part due to cost, and that may change over time. The other time where it's really helpful for an in-person visit is in the setting of chronic kidney disease, where looking at the urine sediment from a urine sample can be critical in diagnosing glomerulonephritis or other inflammatory conditions of the kidney. Super hard to do that remotely. I think from the patient's perspective, one of the main concerns we have is the need to have a high-speed, reliable internet service. And this, unfortunately, highlights one more disparity that exists in our society, of which we've become so acutely aware of in recent times. When we think at the dialysis clinic level, there are infrastructure demands in terms of providing connectivity for patients and doctors. And we need to make sure that that telemedicine platform that we use provides adequate encryption and data security to protect patient information. I think ultimately, one of the single most important issues raised by telemedicine is that it has to be the patient's choice about whether to come in for an in-person visit or to engage in a telemedicine visit. It has to be the patient's choice. I can't say that enough. There are patients who clearly may feel isolated or anxious about being at home rather than coming into the clinic. And so, we recognize that both patients and providers really value in-person interactions because I think, part of our communication is through body language. It's through facial expression. You can't see any of that right now with me. And there's other more subtle cues that I think contribute substantially both to patient assessment as well as simply building a patient-physician relationship. When we think about other disadvantages, particularly for in-center hemodialysis patients, the need to try and schedule telemedicine visits for a large number of patients can be daunting. So, for example, if I'm rounding in our dialysis clinics and I have a shift of patients that may have 16 patients that I'm going to see over the course of their treatment, for me to try and arrange 16 telemedicine visits and be able to make that work reliably is actually quite a logistic hurdle. And so I think that's one of the disadvantages on the in-center side is that it's actually more efficient from the physician side to be able to actually go around and see people in person and have those visits rather than through telemedicine unless, we absolutely have to do that. I want to add a footnote about one of the requirements for telemedicine that I think it's important for people to be aware of. For most patients in most states in the U.S., patients typically have to be in the same state as the provider to participate in telemedicine. So, for example, my license to practice medicine is in the state of Michigan, and I'm not allowed by law to provide medical care for someone in another state. Now, there is some variation from state to state in these rules across the country, and some states have reciprocity. But it's just something to be aware of if someone's traveling or out of state and wants to try and do telemedicine while they're away from home. If we go to the next slide. So I typically think of telemedicine as coming in kind of two different flavors for dialysis patients. There's the fully remote option, in which the patient doesn't come into clinic at all during the course of the month and interacts with all of the care team members remotely. So this requires a little bit of planning, but labs can get obtained locally. Medications such as EPO for anemia can be delivered to the home. And so it is possible to do this completely remotely. But what I think many people are doing is more of kind of a hybrid approach, where a patient comes into the clinic and they can have a face-to-face encounter with the nursing staff and the social worker and the dietitian. Obviously, during that visit, we can draw labs, and if there's medications like iron or EPO that we need to give, we can do those kinds of things. But the key is that the encounter with the provider can be coordinated through telemedicine, either at that time or another time. So, for example, you could have a scenario where the patient's in clinic and the provider's not in clinic but can reach them through telemedicine. More often, we can do it another way where neither the patient or perhaps the provider are in clinic. We can set up that encounter at a later point. And this approach offers all the advantages of an in-person visit. So, for example, the nursing staff can look at the dialysis access. And as I mentioned, we can give medications if needed. But we've got flexibility with telemedicine so that patients are less limited by a provider's clinic schedule. In addition, by coordinating the timing of that clinic visit when blood work gets drawn or whenever blood work gets drawn with the provider visit through telemedicine, I think there can be a more helpful discussion because results from the blood work are available for review. And sometimes when patients only come in for one visit a month, the patient may see everybody on the care team, including the provider, for a face-to-face visit, but we're getting the labs at that visit, and then that means that the follow-up for that blood work occurs after the clinic visit, typically over the phone, to deal with any issues that are related to the lab work. We'll go to the next slide. Okay, so how can we best prepare for a telemedicine encounter so we really get the most out of that visit? Well, I think just like an in-person visit, it's really helpful to jot down issues that have occurred since the last visit and any concerns or questions that you want to be discussed. I have a patient who every month comes into clinic with a one-page typed agenda for the issues that he wants to talk about during that clinic visit. And at first it was a little daunting, but then I realized it really helps give a structure to the information flow. It provides the backbone for our discussion. And in the end, I know that when that patient leaves, he's got all of his questions answered, and we've had that discussion. I always ask patients during a clinic visit, what's on your agenda to talk about today? And so it's really helpful when patients have that kind of organized list that can guide the discussion. I also think it's really helpful for the provider to have dialysis treatment data to review during the encounter, or to have that data to review even before the encounter takes place. So for home dialysis, many of the new peritoneal dialysis cyclers can transmit that treatment data to the clinic directly. But some patients who are using older peritoneal dialysis cyclers, may still have to handwrite down that treatment information and then either fax or email that to the clinic. But having that treatment information ahead of time is really helpful to be able to look through to see how treatments are going. The same holds true for home hemodialysis patients. Again, machines like the NextStage, for example, transmit that treatment data automatically, but you have to have the wireless set up and be able to do that. So being able to have the treatment records for review, I think, is really critical. Obviously, as I mentioned, having blood work done ahead of time so that results are available for review during the encounter also helps providers make real-time decisions about any changes that are needed in the treatment. So getting blood work done with enough time for those results to come back and be reviewed, I think is really helpful. And then the last part is having medications on hand in terms of things to do to prepare for the visit. So this does a couple things. One, it allows us in the clinic to be able to have an accurate list of both the medications in terms of the names of the medications and the doses. On the patient side, it's a great time to review any refills that are needed. And in my chronic kidney disease clinic that I run, I work with a nephrology or kidney-trained pharmacist, and before the COVID pandemic, the pharmacist would review all the patient's medications at the clinic visit before I would go in and see the patient. And since we moved with the COVID pandemic and people started working remotely, the pharmacist started calling patients at home ahead of time before the clinic visit. And after a couple months of doing that, she quickly realized that she was actually being more effective by reviewing medications when patients were at home, because you have the pill bottles there and you can see the labels and you know exactly what you're taking. And so the pharmacist is able to get more effective information and be more helpful overall when people were at home with their pill bottles. So I think that's really critical for a telemedicine visit, is to have those on hand and be able to go through them. It's just, as I think many people appreciate, people who are on dialysis take an enormous number of medications. The pill burden is huge. The number of medications is daunting. And so it's so important that we have a good grip on what the medications are, to be thinking about drug-drug interactions or making sure that the dose is appropriate for the level of kidney function. So I just think that's a critically important part of what we do as providers, is make sure that medications are being safe and effective. Okay, so if we go to the next slide, so that's before the visit. What about during the visit itself? Some things to think about for a telemedicine visit. It's important to choose a setting that's going to minimize any distractions and allow for some privacy. And I certainly understand that when people are at home, it may mean that there's young, kids around, and sometimes they're going to come running and screaming through the visit, and that's okay. But if it's really disruptive, then it obviously distracts or detracts from the overall encounter. given the limitations and the other issue, about setting, in addition to trying to find a quiet spot, is also a spot that's got some privacy. And while I certainly get it that sometimes people are trying to be at work and do a clinic visit, it may mean that stepping out of that environment to have some privacy to talk about issues is helpful. So given the limitations of the physical exam with telemedicine, the more that patients can do to provide a good video image of themselves, I think the more helpful it is. And so that means trying to minimize backlighting, so not sitting in front of a bright window if you can avoid it, goes a long ways so that we can see a bit better. And I know this may sound kind of silly, but trying to actually be in the frame of the phone or the web camera so that I'm not just seeing the top of your head or some other random body part, or worse, just the ceiling of your house. And I know that seems obvious, but I don't think everyone appreciates the information that we can get or that providers can get from the image of patients. So that's super helpful. Depending on the complexity of the telemedicine platform, I think it's always a good idea to log in early and allow time for connectivity problems or other technical issues that may need a few minutes to kind of try and troubleshoot. And then just like an in-person visit, it's really helpful to have a care partner present when possible. This can be to help provide additional history or take notes or even potentially helping, with part of the physical exam. And then in terms of topics for discussion, again, similar to an in-person encounter, we would often want to include a review of how the past month has gone, both in terms of general overall well-being, as well as any specific problems or issues that have come up. Obviously, reviewing the dialysis treatments and any specific issues related to those, lab results, fluid balance, and any other medical problems that come up that are appropriate to talk about. And lastly, I think it's important to talk about patients' short-term and long-term goals. And this can be from the medical side in terms of perhaps better control of phosphorus or fluid balance, or long-term goals such as how to be active on the transplant waiting list or smoking cessation. I think it's also important on a regular basis to talk about patients' personal goals. This is so much of what drives what people do day to day and for, why people choose to do dialysis. By having those discussions with patients, I know that I've got a patient who's gone back to school as an adult and someone else is trying to start up a small business. We learn about these things by having those discussions about goals. And then lastly, in the midst of the COVID pandemic, absolutely need to spend time talking about people's emotional health and their emotional well-being and what are people doing to stay busy and how are we fighting off the isolation that comes with this pandemic and how to better cope with it. And there are all sorts of resources. I know that the social worker that I work with is constantly sending this information out to people to help them with coping skills and thinking about mental health and stuff like that. So sometimes the most important part of my telemedicine visit is simply asking the question, what are you doing to stay busy and how are you doing with all this lately? Sometimes the dialysis is the least of the issues to discuss. If we go to the next slide, in terms of physical exam, I think that's, as I mentioned, the biggest challenge with telemedicine. And there are a lot of observations that a provider can make. I've listed some of them here on the slide, again, assuming that I'm not looking at your ceiling during the encounter. The biggest concern from the provider side is the inability to listen to someone's heart and lungs. The good news is there are digital stethoscopes that are out on the market that can be used by a patient in the home to assist in a heart and lung exam, even remotely. So these are small devices. Some of them actually look like a stethoscope. Some of them are just kind of cylindrical in nature. And the patient can place the device on their chest, and it's going to transmit heart sounds through the computer to the provider. If the patient has a care partner, you can put this device on the back, and you take in deep breaths in and out, and we can listen to lung sounds as well. So that can be really helpful, but they're not in widespread use because they're expensive. These devices typically start at $200 to $300 a piece, and they go up from there. And so cost is an issue. If you are in a dialysis program that has 25 or 50 patients, that adds up pretty quickly in terms of an investment for infrastructure. So I suspect, though, as telemedicine settles in for the duration, we're going to see these and potentially other devices come into greater use. Particularly, like all technology, as time goes on, the cost is going to come down. It's going to be more affordable. They're going to be easier to use, and I think we're going to see that come into play a lot more. The other thing that telemedicine works quite well for, in addition to just regular taking a photo, are, examining the vascular access and exit site and skin problems and wounds. So all those things actually work pretty well. Even looking at the ankles for edema works pretty well with telemedicine. So some portions of the exam we can actually do pretty well. If we go to the next slide. So I want to talk a little bit about, we've talked about so far about telemedicine as it relates to home dialysis, but during the pandemic, as I mentioned, it can also be used for care of patients receiving in-center hemodialysis. And this would be in place of the monthly comprehensive visit from the provider. I think the decision about whether to use telemedicine for an in-center hemodialysis patient during the pandemic is going to largely depend on the rates of COVID-19 in a given community. So for areas where COVID infection is relatively low and things are under reasonable control, this may not be an efficient way for providers to see patients, as I mentioned earlier, just trying to schedule all those telemedicine visits. But on a personal note, even when things weren't so great and the rates of COVID were high in our community, I felt it was important for me as the nephrologist and as the physician to be physically present in the dialysis unit. And this was to support the patients as well as the nurses and patient care techs, because none of them had a choice about coming into dialysis, right? So it didn't seem fair that I could choose to stay home and do all this remotely when we're asking everybody else to come into the clinic. And so I stayed on the front line through the worst of it. And I felt that was important to have a physical presence. In other areas, we're using telemedicine a lot in the midst of the pandemic for chronic kidney disease patients who are not on dialysis. And we found this works incredibly well. Patients can monitor their blood pressure at home. They can get labs done ahead of the visit. And we can have really productive telemedicine visits with our advanced CKD patients and still keep in touch so that we're not deferring that critical care in patients with really low levels of kidney function. And telemedicine can also be really helpful in patient education. So again, before the pandemic, we would do regular in-person classes to discuss modality options for patients with advanced kidney disease who are trying to decide between hemodialysis and peritoneal dialysis. And being able to move these classes to an online platform has been really helpful to provide that education. On the transplant front, that's also moved to telemedicine in the midst of the pandemic, and many centers are doing their initial transplant evaluation with telemedicine visits to save the in-person visits for people who are further along in the evaluation process. And lastly, telemedicine for some things can be helpful for providing care in between routine visits or to help troubleshoot problems that come up that may not require an in-person visit. So I think there's lots of potential applications that we are just starting to discover now. And I can tell you that, at least at our institution, we've made a commitment to provide at least a third of our patient encounters, and this is even outside of the dialysis and kidney disease realm, a third of our encounters to be telemedicine visits moving forward. So clearly, even in the post-pandemic world, whenever we get there, we're going to be doing telemedicine for the long term. It's here for the duration. And so if we go to the next slide, just to kind of summarize what we've talked about so far, telemedicine can clearly improve access to care. It can help with the flexibility in scheduling visits, but it needs to be used in conjunction with in-person visits, and it shouldn't be seen as a replacement for those visits. Lastly, and again, most importantly, incorporating telemedicine into routine care has to be the patient's choice. So I'm going to stop here, and we've got, it looks like, probably about 20 minutes or so for whatever questions that you have.
Yes, thank you, Dr. Segal. Thank you for sharing your experience and expertise. We really do appreciate the information. We now want to hear your questions. If you haven't already done so, submit any questions you might have for Dr. Segal using the chat feature or the Q&A through WebEx. We did get a question that came in earlier, and so I'll start with that. And the question is, I had a first-time visit with a PCP doctor the other day. I felt like we didn't connect and she didn't see me as a whole person. She prescribed a medication, but I'm concerned about the side effects. I liked being able to have the visit in my home and not traveling. How can I make sure I'm able to connect with my doctor virtually?
Yeah, that's a great question, and it clearly highlights some of the difficulties with telemedicine in terms of making a real bond or connection with the provider, particularly when it's that initial visit. So one suggestion may be to consider, if you're seeing a provider for the first time, that may be the time to think about an in-person visit and save the telemedicine visits for follow-up once you've kind of had a chance to really be able to see each other and to kind of explain who you are and what your goals are from the care. So, it's always unfortunate when that connection doesn't happen, and it's but maybe an in-person visit, particularly up front, is one way to try and minimize the chance for that to happen.
Okay, thank you. We got another question. Hold on, where'd it go? What strategies may be helpful for folks who have difficulty with reliable or access to internet?
Yeah, that's clearly a struggle, and this is the part that just kills me in terms of disparities in care. So I think that having the phone as a backup is probably at least for right now, the best way. So one option is to try and do the video visit or the telemedicine encounter from a place that has a better wireless connection. And so sometimes the trade-off may be, rather than doing it at home, if there's someplace to go that's got better internet, that clearly may not be possible for a lot of people and sort of the root cause of the problem. Then I think the option is to default to a phone call, which again, it's not as good as being able to see that, that physical presence. But if it's the difference between, having the encounter and not having the encounter, then probably having phone as a backup and maybe making that clear up front so that people know. There are some of the platforms do have accommodations for low, data transmission from the internet and can kind of divert to a low data mode. I'm not sure how helpful that is, but it's clearly one of the limitations that we have right now.
Thank you for that answer, Dr. Segal. And again, for those of you who would like to ask Dr. Segal a question, please use the WebEx chat feature or the WebEx Q&A feature. We do have a comment and a question that came in. It said, thank you for stressing that telemedicine has to be the patient's choice. Have you happened to have a patient that did not want to conduct a telemedicine visit?
I have actually. In fact, I found myself in the situation where a patient who lives 2 hours from our clinic, and so clearly the commuting is going to be a big issue. and was actually doing okay. Like, I didn't really, from my perspective, didn't see a pressing need for an in-person visit. And so I was kind of trying to push a telemedicine visit to say, look, we really are just trying to work on your blood pressures, and we can do that in telemedicine, and you've been doing a great job recording them, and I've got your blood work. Like, you don't need to make that trip. And, they said to me, they said, look, I know it's a long drive, but we feel like they were hesitant to do it. Like, we don't mind the drive. We just want to come in and see you in person and have a usual clinic visit. And so my response was, absolutely, we will make that happen. There's no reason. But, I wanted to at least offer it so they knew they had a choice. But in the end, when the patient says, I want to come in, the answer is always yes.
Thank you. Another question. When I talk to my doctor through telemedicine, I always feel like she is looking somewhere else and not at me. Are you doing other things when you are talking to patients through telemedicine?
Yeah, that's a great question. And unfortunately, I have a problem with that too. And there's a couple things that may be going on. So one, if the provider is using an iPad, the camera on the iPad is off. If you're holding it horizontally, you'll notice that the camera is off to the side, which means that if you're looking at the screen, you're looking at the image of the patient. From the patient's perspective, you're not looking into the camera. And, we are really accustomed to picking up on those verbal cues from people. If you're having a face-to-face conversation and somebody's looking off to the side, like, we all recognize that's not normal. And so that is accentuated during these telemedicine visits. So the one issue may be, where is the web camera relative to the provider? The other issue is, I often will have a patient's chart open, when I'm doing the telemedicine visit. And so I may be looking up a lab result, or I'm looking up some, test result or something in their chart while we're having a conversation. And so again, my eyes are not looking directly into the camera. And I know that patients perceive that I'm not looking at them. But I'm actually involved in their care and I'm engaged in the discussion, but it doesn't look good from the patient standpoint. And so it's, it would be really helpful for providers to kind of let people know that up front and say, hey, I know it looks like I'm looking off in the distance, but I've just got your chart open and I'm checking X, Y, or Z. It would probably go a long ways towards trying to make people feel a bit more comfortable. But that's a great point about where people are looking during the visit.
All right. Another question that we received, how many other people are on the call, the video, when you do a telemedicine visit? I think this person is asking how many other healthcare staff members are on the call.
Right, and that depends on the provider and the environment, and there's a lot of different ways to set it up. So, when I'm doing a telemedicine visit, it's just me and the patient, and I'm typically I'm either at home doing this from my, from my office at home, or I'm in the clinic in an exam room that I'm using for the telemedicine visit. And so in that situation, it's clearly one-on-one and it's private. But depending on the clinic situation, it may be an opportunity. There may be nursing staff present. There may be the social worker, a dietitian present. They may be sitting off in the background. I think it's really important to have full disclosure at the start of the visit. And so if somebody else is with me, if I have a fellow or a resident or trainee, a learner with me, I want to make sure that the patients know that that person is present from the get-go. And so it would be ideal for the provider to say, oh, by the way, Karen, our social worker, or Elise, our dietitian, is joining me in the room today, or your nurse is here today, so that you know who's in the room. But if that doesn't happen, I think it's perfectly reasonable at the start of the visit to ask, is there anybody else in the room with you today from my care team or otherwise? A perfectly reasonable question to ask up front. The other thing to be aware of, particularly if people are getting care at an academic institution where there may be trainees like fellows or residents, some of these telemedicine platforms allow for multiple people to be joined remotely. So there may not be anybody else in the room with me, but a resident or fellow could actually be joined into the room. Now, that will be obvious because there'll be a video image of that person, and so you'll know instead of just the one window back and forth, there'll be a couple windows to see the other people there. But I think in the end, asking up front, is there anybody else in the room with you today from my care team is a great way to, I think, politely say, are you really by yourself or not?
Yeah. One of the other questions that came in is, I have felt a little rushed in a telemedicine appointment. Is there a customary time for telemedicine appointments?
Right. There isn't. I think that's going to depend. I think the time is going to depend on the provider's schedule and so, for example, when I schedule a telemedicine visit, I leave 30 minutes for the appointment. Now, often we don't always need all 30 minutes, but sometimes I do, and sometimes I need more than 30 minutes. So in that scenario, if it's feeling rushed, I think it's okay to ask and say, hey, last time we didn't get to go through all of my agenda items, or it felt like this was a little quicker than I wanted it to be. Is there any way we could schedule a little bit longer time frame? Many providers will have time blocks in their schedule, and so they may work in shorter increments. And what you can do is, essentially double book or book, 2 visits back to back. So if it was going to be a really complex discussion, sometimes I'll say, look, I need to book 60-minute slot, or I need to visit, 2 20-minute slots so I get 40 minutes. So I think it's okay to ask if you have a visit that's rushed, just like an in-person visit. There's nothing wrong with saying, I'd love a little more time for our next visit. Is there any way you could book a bit more time for me so that we can get through all the issues? That's a perfectly reasonable request to make.
Okay. Again, for those of you on the call that would like to ask Dr. Segal a question, you can do so by sending it through the WebEx chat or the WebEx Q&A. And we just got one in. And the question is, how do you handle the situation where a patient refuses to participate in telehealth? Some patients don't answer the phone or log on at the appointment time month after month.
Yeah, that's clearly a challenging situation, and I wonder whether patients in that situation are, whether they're also coming to clinic visits regularly. I mean, if this person is not able to participate in telehealth but comes to the clinic regularly, then I think that maybe just saying, look, telemedicine's not going to work for you. Let's just go back to in-person visits, and we tried it, or to see if are there barriers. But I know that communication sometimes with patients at home can be quite difficult. And then there's always this question of if a patient's not coming in for visits or not participating in visits in one way, shape, or form, is that person really appropriate for home dialysis? I mean, is the real question, would they be better to come, in center for treatments? And I don't know the answer to that. I hate making punitive decisions about somebody's modality choice, but I also want to make sure that if we're providing care, that it's safe. And you have to be able to have safe care. You have to be able to review treatment records and get labs and be able to interact with patients. And so if they're not doing that, then sometimes that may be a condition to sort of say, look, if we can't figure out a way to get you into the clinic or do telemedicine, then maybe home dialysis isn't really the best option for you for right now. But those are frustrating. The one thing I'll say is that with the ability for telemedicine, it does give some flexibility for rescheduling. And so sometimes if people miss a visit, you can say, okay, well, it didn't work this week, but I can add you on next week for a telemedicine visit, if there's some legitimate reason why they really can't do it. So you do sometimes have some flexibility with rescheduling, but that's not perfect.
All right. And I think this is our last question. Do I need to be trained on Any special equipment to do telemedicine?
So typically not. Most health systems or providers or clinics that use telemedicine should have some simple instructions on how to log in and what are the software requirements that you need. For example, in our health system, we use an Epic-based electronic medical record. That's one of the largest electronic medical record providers in the country, and we have incorporated Zoom into those electronic medical record video visits. So patients have to have Zoom loaded onto their computer or device, and they have to have the patient portal application on their device. And once they have that from a technical standpoint, there's some pretty simple instructions for how to log in. So most people do need a little bit of help. That's not unusual to have, but with some clear step-by-step instructions, we found that the vast majority of people can navigate the software and get into the visit and do it without too much difficulty. But a little bit of instruction certainly goes a long way to help.
All right. Well, Dr. Segal, thank you very much for the time that you've given us today. We really appreciate you being on the call.
My pleasure. Thank you for the opportunity.
So earlier during this call, we shared 2 areas of the NCC website to gain access to valuable resources. We would now like to share with you a few telemedicine-specific resources that you can find on the NCC website. The first one is the Kidney Patient Care, Your Guide to Using Telemedicine Toolkit. This toolkit was created to support the patient transition to telemedicine during the COVID-19 pandemic. It includes information about the benefits of using telemedicine, how patients can start using it, and the equipment needed to get started. The guide even shows patients how they can track their healthcare appointment. Next slide. We also have the handout, The Doctor Will See You Now, Telemedicine Made Easy. This resource highlights the benefits of telemedicine and has 10 sample questions a patient can ask their healthcare team during a telemedicine visit. Both of these resources are available at kidneycovidinfocenter.com. For our final resource, we want to remind everyone about the kidneyhub.org. It's a mobile-friendly web app developed by the NCC with lots of input from our patient subject matter experts. It has information on home dialysis, the kidney transplant process, infection prevention, mental health, and more. I have it saved to my home screen on my iPhone, and it makes it extremely easy to access useful information. We hope you check it out today. As a reminder, our patient COVID-19 webinar events have moved to every other week. So our next patient event is Tuesday, October 6th, and the next professional COVID-19 call is next Wednesday, September 30th at 3 p.m. Thank you all again for being with us this afternoon. For additional COVID-19 resources, visit the CASER website at casercoalition.com. Thank you, everyone. Have a good evening.